Medical professionals, what is the stupidest misconception a patient has had about the human body? When I was fresh out of med school and doing rotations in obstetrics, I met a woman who was just shy of 6 months pregnant. She was kind, soft-spoken, and a little nervous. Nothing unusual. We were reviewing her ultrasound results. Everything was going smoothly. No red flags medically. But she seemed tense in a way that didn't fit the clinical picture. So I asked if she had any questions. She hesitated, then asked, "So, when is the surgery scheduled?" I paused. "Surgery." She nodded. "You know, to get the baby out. Like, when do you pick the date?" It took a second to process what she was asking. "You mean like a C-section?" "Yes," she said. "That's how they're all born, right?" I genuinely thought she was joking at first, but the expression on her face didn't budge. She wasn't trying to be funny. She was terrified. I asked gently, "Has anyone talked to you about vaginal delivery?" Her eyes widened. "What do you mean?" "The baby comes out through the birth canal, through your vagina." She looked absolutely horrified. Like, I just told her the baby would crawl out of her nose. "Wait, it comes out down there? How is that even possible?" I walked her through the basics. How the cervix dilates, how the body prepares. She sat in silence, hands on her stomach, just shaking her head. No one ever told me that. It was one of those moments where the air in the room just feels heavier. She'd gotten pregnant, gone through months of appointments, and somehow no one, not a doctor, not a nurse, not her family, had said the word vaginal to her. Not once. She wasn't stupid. She was uninformed. And that's something I ran into more times than I could count. Like the guy I overheard in the waiting room of a pregnancy clinic, talking to what I assumed was his brother. His partner was pregnant, and he just couldn't wrap his head around how it happened. She was standing up, "Man," he whispered. "I don't get it. The sperm would have just come out." His friend nodded seriously, equally confused. "Yeah, gravity and all that." I wanted to laugh. I didn't, but it took everything in me not to turn around and offer a quick lecture on how reproduction works. I think they genuinely believed gravity had the final say in whether or not conception was successful. And then there was the guy who came into the ER with slurred speech and one side of his face drooping. Classic stroke symptoms. We got him on the fast track for scans and interventions, but during intake he seemed weirdly calm. Not just calm, dismissive. "I'm good," he kept saying. "It's just my speech. I'll go to sleep and be fine. Or you can just get me one of those brain transplants. That's a thing now, right?" He said it like someone asking for a new pair of glasses. Like he thought a chunk of brain could be swapped out like a battery. I remember the nurse and I just looking at each other across the curtain divider, both speechless. "No," I said, "that's not how it works. There's a deep current of misunderstanding in the general public about how the body functions. And it's not limited to emergencies or rare cases. It shows up in the smallest, most routine questions. I'll ask patients if they have any health conditions. Nope, they'll say confidently. Any medications? Oh yeah, I take metformin. And I've got lisinopril too. So, diabetes and high blood pressure? Oh yeah, I've had those for years." It's not deception. It's not even denial. It's just a complete disconnect between their lived experience and the medical language they've never been taught to understand. No one's ever sat them down and explained what those pills are doing, what those numbers mean, what those diagnoses actually are. They know the words, but not the implications. I've seen it enough times now that I don't get frustrated anymore. I just take a breath and I explain. Slowly, clearly. I use diagrams. I draw. I ask them to repeat it back to me. Because if they leave that room still confused, it's not just their mistake, it's mine too. That pregnant woman ended up delivering vaginally, by the way. I wasn't there for the birth, but I saw the notes in her chart weeks later. She'd chosen to go through with it. The midwife wrote that she held her baby on her chest and cried. I hope someone told her she did a damn good job.